Welcome to Amazing Mind, the HMI web TV talk show that introduces you to all sorts of interesting people and topics related to subconscious behavior. My name is Lisa Machenberg, hypnotherapist, HMI instructor, and host. Today we have an amazing guest who's going to talk to us about EMDR. So please help me welcome my very special guest, Zari Hedayat. Now, Zari is a psychotherapist. She is a marriage and family counselor. She has her Ph.D. in clinical psychology, and she is also a professor over at Antioch University in Los Angeles, California. Thank you so much for coming on, Zari.
My pleasure.
Can you tell us, many people aren't familiar with it, what is EMDR?
EMDR stands for Eye Movement Desensitization Reprocessing. Its founder is Francine Shapiro, a clinical psychologist, who actually happened to stumble upon this method, so to speak, by accident.
How?
She was walking along one day and noticed that she was having some disturbing thoughts that spontaneously became less disturbing. And so she started paying attention to what might she be doing, and noticed that her eyes were moving in a sort of a bilateral horizontal fashion. And she became intrigued and then tried to do it intentionally. She would think of something disturbing and do the eye movement and notice the same effect, which was that the thought would become vague and more distant and less disturbing.
Why would something like that work?
Well, that's because we have an amazing brain,
and
really what that does is it taps into your brain. Well, first of all, EMDR is a treatment for post-traumatic stress disorder. It is now recognized as an effective treatment and is part of the practicing guidelines of organizations like the American Psychiatric Organization and the Department of Veteran Affairs and Department of Defense. So, as many people know by now, our brain, we have about 100 billion neurons in our brain, and each time a neuron fires, it hooks up with 10,000 other neurons. So if you think about 100 billion neurons and each of them hooks up with another 10,000, then you can imagine what's going on in there at all times. And there is a saying in neuroscience that neurons that fire together wire together. And that's really an important concept when you think about trauma and the EMDR intervention, for example. Because what I've learned from EMDR is that our brain is an information processing machine, so to speak. It has its own natural ability to process information. And we're processing information all the time. We're processing information from the outside in terms of sensory stimulation. We're processing information from the inside in terms of what we're feeling. And we're processing our thoughts. So there is a lot going on at the same time. And the brain, of course, needs to tease out what's important for its well-being and what's not, and it has a tendency to discard that which is not necessary and retain and process, take in and digest what's necessary.
So using the bilateral, both parts of the brain, is that a natural way of discarding old traumas we don't need?
Well, for the information processing machine to work, you need all of it, right? Yes. So all of it means right, left, back, middle, front, the whole thing. In a traumatic situation, what happens is the event is too disturbing for the brain to be able to do what it would normally do. And parts of it shut down, like for example, the left hemisphere, which is where language is, which is where your sense of self and your sense of planning, doing things in a linear fashion, sort of shuts down because you're in the moment, you're cut into that horrible survival mode, and the information that comes your way tends to then stay stuck in the nervous system in terms of sound and visual and sensations and feelings.
Is that why when someone has maybe come back from a combat situation and now they're back, they're home, they're safe, something as simple as thinking about going out to a mall or getting into a car and driving has the person to feel unsafe again?
Absolutely. In fact, combat veterans and other people with traumatic events, one of the symptoms is nightmares, right?
Yes.
So during sleep, during dreaming sleep, we have rapid eye movement, which is, again, the way the brain processes stimulation, daytime information, and we know from combat veterans and others who suffer from post-traumatic stress disorder that when they have nightmares, they wake up. And part of the idea here is that the eye movement can't do it. It can't engage all of the brain to target that particular kind of memory. Because like I said, neurons that fire together wire together. And a memory is nothing more than an approximation of those neurons firing in that same kind of way, but it never replicates itself completely. So really memory is association. Okay, so you're in one memory which associates to another, to another, to another, and pretty soon you're in this neurocircuitry and you're looping around because one association leads to another, but it stays in that very overburdened, undigested.
Like undigested food,
Absolutely.
Getting stuck.
Yeah.
So by replicating deliberately the bilateral, we can help get it unstuck. Now, you said that there are 3 ways to have the bilateral, to replicate the bilateral stimulation of the brain.
Right.
Can you tell us about it?
Well, there is the eye movement, there is the tapping, and there is the auditory. We can use headphones with bilateral auditory sounds. The right side of your body taps into the left hemisphere of your brain, and the left side of your body taps into the right hemisphere of your brain. So that's why the bilateral brings in both sides. But what happens when you go into those memories, EMDR tries to target the memories that have not been able to be processed in a adaptive kind of a way. You want to bring it back to an adaptive processing capacity. And for that, you know, when a memory is very disturbing, part of what goes with it is a sense or a belief about oneself that tends to be negative, automatic, and unconscious, and we're not aware of it. So it's we remember the subjective, horrible feeling of what happened when the earthquake happened, but we don't realize that there is a thought that goes along with that, and the thought is, I'm out of control. The thought is, I can do nothing about it. Or the thought is, it's all my fault. People are not aware of the thought, the self-belief that goes along with the traumatic memory.
So do we have to bring it up so people become aware of the negative assumption, the thinking error, if you will,
Exactly.
that goes along with the trigger?
Absolutely. So you want to bring up not just the sensation and the memories, but you also want to bring up, what does it make you feel about yourself? What does it make you think about yourself?
That's a very important component.
Yes.
I'm going to shift gears a little bit now, Zari, and you talked about how Dr. Shapiro discovered it. What turned you on to EMDR?
Well, you know, I've been practicing psychotherapy since 1986, and I actually love my talk therapy. But I realized that there are certain things that could not be treated effectively in the kind of talk therapy that I had learned to do. Psychotherapy in general is very much of a top-down kind of a process. You talk about things, you think about things, you try to access feelings, but not everything is accessible in that top-down fashion. And really EMDR is a bottom-up. As I believe hypnotherapy probably is that you're able to tap into the body or into the brain in a way that doesn't put the pressure or the responsibility on the client to tell me about the trauma. Mm-hmm. Well, I can't tell you about the trauma because I don't have the words to say it, really, exactly. But it's still in my body. I still live with it every day.
Yes.
So how do we reach that? And that was how I became interested in EMDR and other interventions.
What would be some of the presenting issues in a hypnotherapy setting or in a psychotherapy setting where you would say, time to bring out the EMDR?
Mm-hmm. Well, you know, if it's a post-traumatic stress disorder, then that's clear. You want to target the event or the most disturbing events. If it's somebody who is really doing well in every other area, but you know, they just can't get along with their one child, or they a stumbling block of some kind that sort of doesn't make sense, really.
Yes.
Then you can target that.
So it sounds like we use it when our client gets stuck. You know what, Zari? I would like you to teach us one of these bilateral exercises when we return, because we need to take a short break. But when we come back, we are going to actually talk more with Zari about EMDR and learn a technique that every single one of us can take into our hypnotherapy office or even use for ourselves. Please stay tuned.
And she became intrigued and then tried to do it intentionally. She would think of something disturbing and do the eye movement and notice the same effect, which was that the thought would become vague and more distant and less disturbing.
Why would something like that work?
Well, that's
Welcome to Amazing Mind, the HMI web TV talk show that introduces you to all sorts of interesting people and topics related to subconscious behavior. My name is Lisa Machenberg, hypnotherapist, HMI instructor, and host. Today we have an amazing guest who's going to talk to us about EMDR. So please help me welcome my very special guest, Zari Hedayat. Now, Zari is a psychotherapist. She is a marriage and family counselor. She has her Ph.D. in clinical psychology, and she is also a professor over at
Accident.
How?
She was walking along one day and noticed that she was having some disturbing thoughts that spontaneously became less disturbing. And so she started paying attention to what might she be doing. And noticed that her eyes were moving in a sort of a bilateral horizontal fashion.
University in Los Angeles, California. Thank you so much for coming on, Zari.
My pleasure.
Can you tell us, many people aren't familiar with it, what is EMDR?
EMDR stands for Eye Movement Desensitization Reprocessing. Its founder is Francine Shapiro, a clinical psychologist, who actually happened to stumble upon this method, so to speak, by accident.